Well, if you have children with allergies, you know it can be more than just a pain. Worried if they go to a birthday party, maybe on a field trip, worried they may eat the wrong thing and get sick, sometimes really sick.
And then, of course, sometimes the parents are the ones who are allergic. Dr. Gerry Lee treats both children and adults. It's good to see you again, Gerry.
Thanks for having me come back.
Thank you so much. We really appreciate it. We want to talk about some of the most common. You brought some of the most common things. Terry and I guessed peanuts is the most common allergy, and you said no.
Actually, most children develop food allergy younger in life, and that's actually milk and egg. But you associate peanut because that's the most common in adults, that and shellfish.
All right, but for kids, it would be more eggs and milk. So how do I know my child just might have an intolerant tummy toward it, or they're really allergic to it?
Okay, well, the cardinal symptoms of an actual concerning allergy rather than intolerance would be rash. It would be more of an itchy hives or whelps, as they would call them. The more concerning stuff would be swelling, difficulty breathing, wheezing, and sometimes you would have loss of blood pressure. That's the most serious type of reaction.
And do these allergies manifest themselves because, it's just a natural process in a particular body, or is it because of some sort of formula that you're fed as a child? What do we know about this?
This is an area of intense research. We do know genetics is involved. We know family history is very important. There's a lot of thought about what are the kind of environmental exposures that could be related to it. We feel that exposure to the skin versus the gut might be different. So there's a lot of research going on when we should introduce food, and really the best kind of measures that we've had the most evidence for is breastfeeding and also introduction of solids at 4 to 6 months of age.
That's interesting. Let's talk here. We've got tuna fish in the front, so shellfish.
Yes,
would
all
be
fish
another
and
one.
shellfish, yes.
All right, and the soy, you said if your child is allergic to milk, don't necessarily assume that they can drink soy.
Yes, there is a slight cross-reactivity sometimes, so it's very common that we would actually assess before we introduce soy into a child if someone's allergic to milk.
We hear the phrase lactose intolerant. Are there varying levels of that, or is it just it's all or nothing?
There is levels of that too, but again, I'm drawing a line between immunologic allergy and just intolerance reactions, which would be like an enzyme deficiency, and so you would get gas and that sort of thing.
Let's say the worst happens and your child does have an allergy to milk, or let's say worse yet, peanuts, as they get a little bit older and then they come into contact or eat. We've had cases where children have died, especially with the peanut.
Right.
So I'm a parent at home. What do I do?
So really, the most important things is getting to know labels. So if you go to the Food Allergy Anaphylaxis Network website, which is foodallergy.org, they'll give you guidelines on what you can do in terms of avoidance, how to recognize the words in the ingredient list that could contain the foods they're allergic to, and also about cross-contamination and that sorts of things. These are very important resources that I think are really helpful for all parents if they come and look up if they have a food allergic child.
I was with a girlfriend at a restaurant once, and she did not know the salad did have nuts, and I'd never seen something happen so quickly where her throat started closing, and it was frightening. I was amazed at just how quickly that kicked in.
Yeah, so it's always important to carry that epinephrine auto-injector with you at all times. The babysitter, school, home.
Make sure everybody has it. Anything else, final comments before anything you'd like to leave people with in the audience?
Well, I think it's not very well known that most food is outgrown. Probably in milk and egg, it's about 80%. Peanut and tree nut, maybe 10 to 20%. So it's also important to go back and get reassessed.
To make sure you haven't outgrown it.
Yeah, sometimes we can. You don't have to have lifelong allergies. Some can be outgrown.
The body then acclimates itself to the process.
Yeah, well, or the body kind of develops tolerance over time. And obviously it depends on what type of food, but I think it's important to have that reassessment on a regular basis.
Good point. All right, thank you so much. Really appreciate it. Dr. Lee sees both adults and children downtown. If you would like to make an appointment, the phone number you can call, 629-3320.